He's going to note a person lying in the middle of the street about 25 feet from a vehicle, apparently ejected, and it looks like he ran into a tree.
All right, wait.
That's
All right, so that's my call.
that's it.
I gotta wait
All right,
for my
so
phone.
we're gonna take action.
You want to hold up and
I'm in a video thing.
who started? You want me to
No.
redo it?
Well, no, I just want to wait before he goes because I had to power my phone on because he's going off in class. So.
Yeah, right.
Everybody ready? I'll be on YouTube in an hour.
Facebook. Check us out.
Don't mess up.
All right, so did you guys get the recording for the scenario?
Yes.
Yeah.
Oh, good. All right. So I arrive on the scene, my call, and I have imaginary partners that I'm going to use and direct them to do certain things. All right. I'm going to go. First thing I'm going to do is BSI.
BSI.
Is the scene
The
safe?
scene is safe.
My number of patients.
1.
All right. Do we need additional help?
Yes, I would call ACLS.
What's my mechanism of injury?
You a person ejected from the vehicle.
All right. So it's a pretty serious mechanism of injury. All right. I'm going to have my partner maintain C-spine on this guy. All right.
C-spine is maintained.
Okay. All right. Red.
Okay.
Next thing.
Okay. What's the general impression of this patient?
All right, my general impression, based on my mechanism of injury, it's going to be probably multi-system trauma. This patient's probably going to have multiple injuries.
Okay. You want to know what they are? The person is noted with a left amputee.
Okay?
So
All
arterial bleeding coming from the left side. So
right, so first thing I'm going to do is go ahead and address that, because that's an apparent life threat.
Okay.
So I'm going to go ahead and come up here. Take tourniquet out of my iPad. Training one.
Stop the
Meanwhile, he's bleeding out.
Is he conscious?
We'll get to that. Here's my bleeding control.
Bleeding is controlled.
All right, so I got my general impression. I've stopped my bleeding. I'm going to check for responsiveness now.
He's
Sir, can you hear me? Can you hear me?
He's unresponsive.
All right, so he's unresponsive. I'll probably make a transport decision right now at this point. He's probably going to be a load and go, which is a little bit further on down the road. All right, next thing.
His life threat.
My apparent life threats is I just took care of the bleeding, but based on my mechanism of injury, I'm assuming he's got some more multi-system trauma.
Okay. You're going to go on to the airway.
All right, I'm going to assess his airway first thing right now. Does he have an airway? Is he breathing?
He's breathing at 8.
What's his rate, rhythm, and quality?
8 respirations. He's irregular and he's snoring.
All right, I'm probably going to put an OPA in right now, so he's probably got some trauma, so I'm going to make sure that we maintain C-spine. Going to do jaw thrust, insert an OPA, and I'm probably going to have my partner bag him for me as well.
When you did that OPA, how do I know that was the right size?
I have to measure it first from the ear to the nose,
Okay.
and then I'll insert it based on the size of the patient.
Okay. Breathing.
All right, what's his rate, rhythm, and quality now? Is it improved?
It is.
Is the airway stable?
It's at 12 now.
All right, so my airway's been secured, my breathing's been secured. I'm going to go ahead and check for any gross bleeding, if we have any gross bleeding other than what I saw earlier. Do I have any gross bleeding behind the head?
None.
Any behind this extremity?
None.
Any behind the abdomen or the chest?
None.
Any behind the pelvis?
None.
This extremity?
None.
Check for pulse down here. Do I have a pulse?
Pedal pulse present bilaterally.
Okay. Any bleeding on this side?
None.
Any here?
None.
Any more bleeding from this? It's secure.
It is secure.
Do I have a pulse over here?
He has a good radial pulse.
Do I have a carotid pulse?
He does have a carotid pulse.
All right, this patient's going to be a low to go at this time.
Okay.
All right, so now
Would you? Are you gonna treat him for shock?
I'm going to cover him up, treat him for shock. I have a blanket right here, but we can still do some more assessments, so I'm going to wait a little bit on that.
Okay. Are you gonna get sample history?
If I can't get a sample history, if there's any bystanders, are there any bystanders?
No bystanders at this time.
All right, at this point, I'm just going to continue to drive on.
Okay. Now you're gonna start with the secondary assessment at this time.
My secondary assessment. Now I'm going to do DCAT BTLS. I'm going to start at the head, looking for any deformities, contusions, abrasions, punctures, penetrations. Do I feel anything in the back of the head?
Yes, you do. You feel a depressed skull.
Okay, is it soft or mushy or
It's
anything?
soft and mushy.
Do I feel any bony prominences, anything sticking out?
Nothing sticking out.
All right, I'm just going to make a note of that. I can't fix that at this moment. I'm going to come down. I'm going to check the eyes. Do I see anything wrong with the eyes?
Nothing, but his
Any
pupils are
fluids?
slowly reacting to light. No fluids coming out of the nose or the ears.
Okay. Anything coming out of the mouth? If I look in the mouth, can I see anything other than the
No
OPAs
fluids, no
in place?
teeth.
Nothing coming out of the ears?
None.
All right, check the back of the neck for any step-offs.
0 step off.
JVD?
None.
Any tracheal deviation?
Trachea intact. Trachea intact.
All right, at this time I'm going to put on a seat collar. We'll go over that and how to placement, but you check with 4 fingers. side of the neck, and then you measure that on the side of the seat collar. We'll show you that when we actually be hands-on. I'm going to come down a little bit further. I'm going to check the shoulder girdle. Is it intact?
The shoulder girdle
Press
is
down,
intact.
looking for any decap BTLS in the chest.
None.
Expose the chest. I'm going to inspect it. Do I see any obvious deformities?
None.
Do I have equal rise and fall?
Equal right
Do I have any tenderness, rigidity, or distension in the abdomen?
None. No distension.
No. Do I have any discolorations?
None.
All right, I'm going to do the pelvic check. I'm going to push down and in. Do I hear any crepitus?
No crepitus.
I'm looking for any priapism. Do I have any priapism?
Zero priapism.
Do I see any rectal bleeding?
No rectal bleeding.
All right, I'm going to come down and check this decap BTLS on this leg. Do I see any deformities, tusions, abrasions, punctures, penetrations?
No.
Still have a pulse?
He does have a pulse.
Okay.
He has a pulse.
I'm going to go on this side. I'm going to go decap BTLS down this arm. Do I see anything noted?
None.
Still have a pulse here at present?
Present.
What's the rate, rhythm, and quality?
80 and 80 and regular.
80 and regular. Okay, I'm going to come down and check this leg. Decap BTLS. I note something here. What do I have? Angulation.
Yes.
We still have a pulse down here, though?
No.
All right. I don't have a pulse down here?
You do have.
I do have a pulse down here. All right. I'm going to splint it where it lies rather than move it and try and lose that pulse.
Okay.
All right. So I've done my head to toe on this side. Got a seat collar in place. I'm going to have my partner maintain C-spine. I'm going to roll him up on the side. I'm going to check his back.
Nothing.
All right. So I'm going to go ahead and do that. All right. We have somebody down here holding his legs. We're going to simulate. All right. Decap BTLS in the back. Do I note anything?
Nothing.
Any rectal bleeding?
No rectal bleeding.
Nothing down here on the legs?
Nothing.
Nothing that was already not noted?
Correct.
All right, come back down like that. All right, now that I've completely checked them out,
Before you do that, when you're looking at the back, what are you doing at the same time?
put him on a long spine board,
Okay.
and I'm going to strap him down. I'm going to cover him up for a minute first, keep him warm.
When can your partner let go?
My partner can't let go until I get the headboard and the head straps on there and the blocks next to his head.
Alrighty. At this time, what can you do? Can you
I'm going to
get a set of vitals
reassess,
on him?
get a set of vital signs, and reassess him every 5 minutes when he's in the back of the ambulance.
Did you get a set of vitals?
I did not get a set of vitals yet. I'll have my partner get a set of vital signs at this time. I did ask you the rate, rhythm, and quality, and the respirations,
Correct.
and the pulse, so I did get some information.
Okay.
All right?
And because of the type of patient he is a what kind of patient?
He is a load and go.
But what kind of patient is he?
He's
Is he
a-
unstable or stable?
He is an unstable
So
patient.
how often are you going to reassess?
Every 5 minutes.
I said, well, that is the end of this